Hi, my name's Stephanie Dickmeyer. I am going to do my presentation for my job shadow project. Getting started, I want to talk about benefits to job shadowing. So, a couple different groups of individuals I think can benefit from job shadowing. First, employees that I think are within a company that are maybe interested in another position or like a leadership position. I think it really brings a lot of value for them to be able to spend some time in that other role to see if it's something that they think that they would enjoy. And for students like us at Central Penn, if we're going to school for a specific major and we have a certain occupation in mind, to be able to do some shadowing in that position or that field of study would definitely be of value. I think the last thing anybody would want to do is run into a situation where they really don't want to do what they are going to school for. I think there's a lot of benefit to see what really a typical day is in that role versus what a job description might have on a piece of paper. Also, for individuals who are applying for a position, it's to me always a good opportunity for somebody to spend some time in that potential position after the interview process is over. So at my practice, where I work in medical practice, when we have individuals that come in like nurses, we ask for them to do some job shadowing after the interview. It not only gives them a chance to see what we do at our practice, but they can meet some of the folks on the team. And on the flip side, the team members can actually meet that person too and see if they would be a good fit. So I think it's benefit both ways in that aspect. My job shadow was within the WellSpan Health organization, so I actually work for the system. I've been there since 2010. I'm currently a senior practice manager. I took a screenshot of just our website. When you click on About My WellSpan, this is the information that pops up on the website. So some statistics, we employ over 19,000 individuals within the South Central region. It's actually one of the largest employers in South Central PA. We provide a lot of services. Not only do we have 8 hospitals, but we also have imaging sites, outpatient labs, rehab, primary care offices, specialty practices, pharmacies, walk-in care. We have behavioral health sites. We are partnered with Philhaven. So lots of good stuff within the system. We have medical offices from Franklin County on the west to Lebanon County on the east. We also have a practice in Carroll County, Maryland. York Hospital is the only level 1 trauma center in the region, and there's also a comprehensive stroke center there too. And for some of the specialties that we don't particularly have a lot of peds stuff, particularly peds oncology, we partner with Johns Hopkins and Hershey Medical Center. Our mission statement is very important to us. We talk about this all the time. So I'm going to read it. It's working as one to improve health through exceptional care for all, lifelong wellness, and healthy communities. Our community involvement. So in 2017, we provided over $246 million in charitable uncompensated care. WellSpan is a nonprofit organization. We are not profitable. So I want to make sure I did highlight that we are a nonprofit organization. We provide focused care on at-risk vulnerable populations across the region, including providing behavioral health needs. We partner with local community organizations to address food availability, end-of-life planning, and pediatric injury prevention. And we provide resources and education to the community regarding obesity, maternal child health, and opioid prescription drug abuse. My job shadow was with Mark Van Eyck. He's operations administrator for WellSpan Orthopedic Service Line. He's actually my boss. He received his master's degree from Shippensburg University. He's been operations administrator for 5 years. He's actually from the Netherlands. Prior to working this position, he was a senior practice manager for WellSpan Community Health Center. That is a department located in downtown New York that works with a lot of Medicaid population, vulnerable population patients. He worked in the trauma department for Lancaster General, and he was a director at the American Cancer Society. So I'll go into detail a little bit about what services WellSpan Orthopedics provides. We do many surgeries, about 15,000 a year. We have within the service line over 250 employees. We do a lot of surgeries, whether it's trauma, foot and ankle, carpal tunnel, revisions, knee and hip replacements. We do a lot. We also have non-surgical sports medicine physicians. They do a lot of injury prevention with athletes and active individuals. We have a sports-related concussion program. We employ athletic trainers in 8 school districts. We actually have contracts with the York Revs baseball and the Skipjacks Amateur Ice Hockey League, which is young adolescents, I think up through 25 years old. They work out of York Ice Arena. So some of the things he's responsible for is making sure he's involved with outpatient and hospital revenue, hitting our targets for budget. He actually works with all the practice managers. We make sure that we work the budgets every year and have monthly numbers that we watch out for. And setting up if there's any gaps in orthopedic services within the region, if there's new locations or new sites we should look at. He interviews new surgeons and healthcare providers. He's reviewing their contracts, having discussions with them about productivity, and just making sure that we are following correct workflows to make sure that we're providing safe, healthy, efficient care to our patients. So my particular job experience, or when my shadowing experience, in the morning we worked on some reports for a big meeting in the afternoon, and he was sidelined by phone calls and Skype messages and lots of burning fires, I would say, that he had to put out or help managers with, or questions from other departments, different initiatives that he's working on that he's responsible for within the organization for improvement. Just a lot of that went on in those 4 hours, as well as working on what we call pro forma. We're looking at a site for another potential office and seeing what we need in terms of support, clinical staff, front office staff, and providers to open based on the hours that we want to serve to the community. In the afternoon, we had a big meeting at our business center, and we were there with the chief financial officer, a lot of the business financial managers, and the operation administrators for all the different service lines within the system. We had to report, well, not me, but they had to follow a scorecard that was set with targets and goals with patient experience information, revenue. They were highlighting wins, talking about challenges and struggles, and how everybody can sort of help each other out, ideas and suggestions. So I thought it was a pretty productive meeting that afternoon. I particularly enjoyed the meeting the most in the afternoon, even though it was a really long afternoon and it was the Friday before Memorial Day. We do a lot of work, frontline managers, but it was nice to see that sort of work its way up through the chain of command within the organization and talk about some of the really cool stuff that's going on. I got to hear some interesting things in other departments that I had no idea were even going on. So that was pretty cool for me. One of my departments is the department's doing well in a couple of things, so I got to share that. I didn't think I was going to have to talk, but they had asked if I could help work with some other struggling managers, and I said I was happy to do so. So at the end of the day, I would say this is not particularly something that I want to do in the near future. I enjoy what I do as a manager, even though it's stressful in of itself and it's busy and I put in long hours. I really do enjoy working with the staff so closely as I do now and working with patients. The administrators work in a building sort of pulled away from there. They travel a lot and they're pretty much on call 24/7. So at this point in my life, it's not something I particularly want to do. Maybe when my kids get older and I don't have as much going on, something I'll be interested in. But at this point, not. I'm just glad I was exposed to this because I think it really put a lot of things in perspective for me and where I'm at and where I potentially want to go in my career with WellSpan. All right. Thanks for allowing me to share my presentation.